All right, someone around you, hopefully it's not you, but someone around you, I pretty much guarantee your neighbor, your cousin, your nephew, your nephew's coworker, your cousin's neighbor, your neighbor's cousin, someone in your orbit is probably frustrated right now, worrying about whether they're getting everything they can out there. A lot of people out there struggling, worrying that they're getting everything they can from Social Security, retirement benefits, disability benefits, Medicare, Medicaid, all the rest of it. So this is kind of going to be a complete insider's guide to all of that. I'm going to go through the entire list. I'm not going to be able to go through every single detail, so that's why we're doing a live Q&A like we do every time this time of the day. So if you're new, make sure you subscribe. I'll talk about an overview of all the programs. People think Social Security is just Social Security cards and retirement. And our community here, by the way, if you're new, welcome to the most compassionate, the best community on social media. Every single day we find people that are frustrated or confused about the entire bureaucracy, and we help them navigate the bureaucracy, and we find people money every single day. So a lot of people out there are living a little bit better, a little bit easier from month to month because they were able to find benefits because people subscribed and liked and shared and all that kind of good stuff, and they were able to find our channel and get those extra benefits and that extra helps. Most of this is what you paid for. So all those decades you paid your taxes, all those decades you paid into FICA, Social Security, Medicare, and all the rest of it. Let's make sure you're getting, and everybody around you is getting what they're eligible for and what they need. Okay, and to make this a little bit easier to follow, not necessarily for you, unfortunately, but I've got a bunch of acronyms there, and I'm going to go through this entire list. These are just some of the programs that are available out there for those people. We got millions of people about to lose their health insurance, millions of people out there struggling from month to month. And so let's make sure that they're getting everything they can. So I'm going to go through this relatively quickly. I'm just going to give a broad overview of all the different programs out there. Quick little talk about eligibility. Each one of these, there's over 20,000 pages of Social Security policy. If you're new to my channel, I ran the third busiest Social Security office in the country. I've taken millions of claims, helped millions of people out with all of these. So there's over 20,000 pages of policies. There's exceptions to the exceptions to the exceptions. And we're not going to get into all that because this would take weeks and weeks and weeks to go through it. So if you're here at the live Q&A, if you have a question, I'll go over this really quickly. And if you say, oh, that might apply to my neighbor, that might apply to me, that might apply to my coworker, let me ask Ed a little bit more details. Type your question into chat there. I've already got some questions there. Type your question in the chat and I will answer it. We'll do this for about an hour or so. If you're watching this on a recording later, make sure you subscribe. Come back to a live Q&A. I do them almost every day. So my wife tells me I need to take a break, but I do it almost every day, 3 o'clock West Coast time, 6 o'clock East Coast time, and you can ask a question during the live. Okay, let's start. So retirement benefits. Pretty much everybody's good on the retirement benefits, but they often file incorrectly. There's early retirement. You can start your benefits as early as 62 years old. There's one you can start at 60. We'll talk about that one. So early retirement at 62, if you start your early retirement at 62, it's obviously reduced. Anytime you take money from Social Security early, whether it's retirement benefits, survivor benefits, spouse benefits, survivor benefits, your benefits are reduced if you take them early. That's different from disability benefits. We'll get into that one. If you take them at your full retirement age, also called the FRA, full retirement age, and then you get your full benefit amount. If you wait till after your full retirement age, you actually get more. It's called delayed retirement credits. So delayed retirement credits are 8%. So if your full retirement age is 67, so if you were born 1960 and after, your full retirement age is 67. If you wait until 70, you get an extra 8% per year, 24% extra. So if your full benefit amount, let's say it's $1,000 at your full retirement age, once you hit 70, you're going to get $1,240. So, and then obviously COLA increases and all the rest of it. One of the reasons, big reasons why people decide when to take their benefits is these next two things, the annual earnings test and the monthly earnings test. So there's limits to how much you can make if you file for benefits early from Social Security. So if you're under your full retirement age, you have to stay under that. For next year, for 2026, that's $24,480. Any money you make after that, Social Security holds back $1 for every $2 you go over. And this is different. Social Security can also switch to what's called a monthly earnings test, a monthly earnings limit. The first year, when you first start filing for benefits, Social Security doesn't care what you made before. They go to the monthly. And that's for next year's $2,040. And I've got a bunch of videos on that. If you want me to go into more detail on that, I'll definitely do it. If your benefits are suspended, they can be readjusted at your full retirement age. It's called the adjusted reduction factor. A lot of people don't understand that one, and they wonder why their benefits are increased or whether they will be increased. So you not only get a COLA increase if your benefits were suspended, then your retirement benefits are suspended, you also get that ARF. A lot of people miss that one. I'm moving Medicare up here a little bit. I wanted to talk about disability next, but because we're in one of the many enrollment periods, let's talk about Medicare first. So we've got Medicare Part A, Part B, Part C, Part D. You got Medigap plans, which are F, G. There's 10 of them, but the most popular are F, G, and N. You've got the special enrollment period, the initial enrollment period, the annual enrollment period, the general enrollment period, the open enrollment period. You got Medicaid, you got dual, you got LIS, MSP. Okay. All right, let's go. Let's give an overview of, again, if you want me to answer specific questions on these, please ask them in our chat or join us later in another live. Okay, Medicare Part A covers your hospitalization. That's what you pay in your FICA all those decades. So that's why Medicare Part A, for most people, 99 point whatever percent of people don't have to pay a premium for Part A. It's 0 premium per month, and that covers your hospitals. Part B covers essentially your doctors, kind of outpatient type stuff. Your doctors, if they go to the hospital to do surgery on you, that's what it's covered. So that's your medical type stuff. That is for 2026. The monthly premium will be $202.90, over a $17 increase over 2025. And then you've got Part C, which I don't like call it Part C, but Part C are those Medicare Advantage plans. By calling it Part C, it sounds like it's part of the original Medicare, but it's not really. You're giving up original Medicare to get privatized Medicare through a Medicare Advantage plan. And over 50% of people choose a Medicare Advantage plan. Usually it's a budget issue. They just can't afford a Medigap plan. So those Medigap plans, they do have a monthly premium. So if it's an F, a G, an N, these are all standardized. A Plan G in Florida is the same as a Plan G in Texas, which is the same as a Plan G in California. They're all the same. The only difference is price. And if you get original Part A and Part B of Medicare, awesome, great. But Part B, there's a 20% coinsurance. So if you get a $100,000 Band-Aid from your doctor, you have to pay 20%, $20,000 of that out of pocket. So that's why people get either a Medicare Advantage plan or a Medicare Supplement plan. And nobody can tell you which one is best for you until they talk to you, ask you a bunch of questions, see what your budget is with your doctors and all the rest of it. Right now, we are in the annual enrollment period up until December 7th. So if you need help with a Medicare Advantage plan, reach out to our partners at Chapter. Just make sure you get the one that's best for you. How do you know? You be prepared. You have your current plan if you have one, so you can compare what's your current plan next year is with what else is out there with your current company or a different company. You have your providers, the providers you definitely want to see in 2026. You have your prescriptions, the milligrams, all that. If you have a particular pharmacy you want to use, you have the name of the pharmacy. You have priorities. You need more dental, do you need more vision, do you need more hearing, whatever the case may be. And then prices. Are you going to be getting a bunch of MRIs next year? Or you might go to hospital and you want to find out how much it is to stay at a hospital overnight or whatever. And then one of the most important things about Medicare Advantage plan is you need to stay persistent. Prior authorizations, networks, you have to keep those guys, your Medicare Advantage plan on, you have to battle those sometimes. And that's what Chapter does. They have a member success team that helps you battle those prior authorizations and all the rest of it. So if you need any help, they're free. Nobody should charge you for helping you find a Medicare plan. They don't charge you. They look at all the plans in your particular area, ask you a bunch of questions, part of those 7 P's right there, and then find the best plan for you, and your new plan will begin January 1st. I've got a video question that somebody sent in. I'll play a little bit later that they didn't understand that the new plan started January 1st, but I'll show that later. All right. So, so Plan C is Medicare Part C is those Medicare Advantage plans. Part D are the prescription drug plans. Most Medicare Advantage plans already have the Part D bundled in there. If you get a Medigap plan, an F, a G, an N, or whatever the case may be, you have to get a Part D standalone plan. If you don't, there's penalties. Just as if you don't sign up for Medicare when you're supposed to, and you don't have creditable coverage, then you're going to get penalties for the rest of your life. So, and if you want me to talk about those, well, that's a whole different, 3 different, videos. Anyway, so you've got your initial enrollment period, you've got your SEP, your special enrollment period, if you move or something like that. You've got your initial enrollment period when you originally turned 65, or you originally start your disability after 24 months. You got the annual enrollment period, which we're in now. You got a general enrollment period. If you don't sign up, then you can sign up for A and B in January, February, March. You'll get penalty probably if you're signed up in general enrollment period. And then there's all kinds of other different enrollment periods. When you can actually sign up and change your plan is probably one of the most confusing things about Medicare. It's crazy. So you can reach out to Chapter and they can see if now's the time for you to do it, or when is the best time for you to do it. Medicaid is different than Medicare. Medicaid is a state federal program. It just got cut about $1 trillion from the federal government. So everybody that's on Medicaid is going to have a tough time going forward. Even if you're eligible, they're going to be nickel and diming you, trying to kick you off, reducing this or reducing that. If you had dental this year, might not next year or the year after. Medicaid is in bad shape going forward. You can't cut $1 trillion out of the budget and expect it not to hurt everybody, and it's going to. So it's unfortunate. So you sign up through Medicaid through your particular state. And some states, a lot of states call it different. You got Access is in Arizona, that's Medicaid. Medi-Cal in California, that's Medicaid. Alaska, I think they call it Denali Care. So yeah, each state, a lot of states call it different things, but it's all basically Medicaid, and it's for low income, low resources. And then a lot of people don't realize you can get both. You can have Medicare and Medicaid, and then you'll get what's called the Medicare Savings Program, MSP, and that is basically where the state pays for if you're eligible, the state pays for your Part B premium. So if someone your neighbors or coworkers, your cousins are having a hard time paying that $185, $202.90 for 2026, then tell them to apply for Medicaid, and hopefully the state will pay for that $202.90 and some other cost sharing as well. And there's also called the LIS, the Low Income Subsidy. That's also called the extra help with your Medicare prescription drugs. A lot of people save money on that one. You apply for that one through the Social Security Administration. I've taken hundreds of thousands of those. Those are one of the easiest applications you can take at Social Security. So, all right, let's get into disability. So again, if you have any questions, if you need help with all things Medicare plans, make sure you reach out to Chapter. Full disclosure, they support this channel. They support all the free websites that we have and all the rest of it. So we appreciate them. Disability. So there's different types of disability. You can get SSDI. That's based on what you actually paid into Social Security. SSDI, Social Security Disability Insurance. And then there's another program that people often confuse, SSI. They think SSI means Social Security income. It doesn't. It means Supplemental Security Income. It is a welfare-based program the Social Security administers. Social Security offices are made up in 3 units, and 2 of those units, one of those are Title II, which I was before I became a manager. Title II, they do retirement benefits, survivor benefits, SSDI, Medicare. And then you've got SSI, Title 16 of the Social Security Act, they do SSI, welfare. And you can get SSI, supplemental security income, either based on being disabled or aged, 65 and older. And the max you can get from SSI from Social Security for 2026 is $994. Some states also give you a state supplement, but from Social Security, the max you can get is $994, either being SSI aged or SSI disabled. SSDI, it depends on how much you actually paid into Social Security. All right. And then we've got DAC. DAC benefits. Those are disabled adult child benefits. So if you have a child that became disabled before the age of 22, I know I'm going fast, so I'm going to start going a little bit faster to just kind of get through these. You can slow me down. There's a little thing on YouTube where you can slow the person down, or my wife mutes me all the time, I think, in her head. But anyway, that's a whole different issue. But if you hear anything, your ears perk up and you're like, oh, that might apply to this, then again, ask your questions. So a disabled adult child, that is if you have a child that became disabled before the age of 22, they can get benefits on a parent's record if that parent is receiving retirement benefits, disability benefits, or deceased. So that's called disabled adult child benefits. And then you've got child disability benefits. A child can get benefits, SSI benefits usually for being disabled. And then you've got disabled widows benefits. That is, you can get disability not on your own work record, but on a deceased spouse's work record. Disabled widower benefits. And you get those between the ages of 50 and 59. Okay. And then probably one of the most difficult things are working while receiving disability benefits. And you can work and receive disability benefits. Actually, Congress and everybody wants you to work. Try to go back to work to see if you're able to work. And if you make more money, then you get off disability. Helps you out, helps us, helps the trust fund out. You pay more taxes, which I guess everybody loves. So there's all kinds of work incentives to get you to go back to work if you're able. If you're not, then it is what it is. But I've got a website, mygovexpert.com. And you just click on the disability there and working and benefits, and it gives you, I've got a worksheet there that it tells you all about it. I'm updating this for 2026, and it talks about all of the details of working and collecting disability benefits. You are able to work. They're called the trial work period, the extended period of eligibility, substantial gainful activity, and all the rest of it. IRWIs, unsuccessful work attempt. It just goes on and on and on and on. Okay. And we also have, if you're receiving disability benefits, you might get reviewed. One of those reviews is a work CDR. So if they find out you're working, Social Security finds out you're working, they will give you a continuing disability review based on your work to see if you're staying under the SGA and trial work period and EP and all the rest of it. There's also regularly scheduled medical CDRs, continuing disability reviews. So when you're approved for disability benefits, they usually give you a timeline that says, hey, every year, every 3 years, every 5 years, 7 years, or never, whatever the case may be, we are going to review your disability to see if you got better, or you've got a surgery that improved whatever, or you got new medication, or they're just going to review it every now and then. And if you're denied, if your benefits are canceled because of a work CDR, for instance, you can get what's called an EXR, expedited reinstatement. So if you have the same disability and your disability benefits stopped because of work and it's within 5 years, you can file an expedited reinstatement. Not sure why they call it an expedited reinstatement, because there's nothing expedited now at Social Security. Elon Musk and Doge in the current administration cut thousands of people that were there to help you navigate the bureaucracy, and Congress doesn't want to provide customer service. They've been trying to, make customer service as terrible as they possibly can at Social Security. So you will hate Social Security or blame the employees, but it's the politicians that give Social Security resources because they want to privatize Social Security. But anyway, Let's get into spouse benefits. So spouse benefits are a form of retirement, but it's a retirement. You have to file for benefits on your own record. There's an exception. What I say about exceptions, the exception. So you file for benefits on your own record, and if you're entitled to benefits from a spouse or a divorced spouse or a deceased spouse, then you can file for those benefits. Surviving spouse benefits, that gets a little complicated. You don't necessarily have to file for benefits on your own record first. You can choose one or the other. So I'll talk about that if there's anybody there that wants to parse that out. And then there's a thing called independently entitled divorce spouse benefits, IEDS, where if you were married to someone and you had to be married for divorce, you had to be married to that person for 10 years. There is a common law thing. So if it depends if your particular state recognizes common law, that Social Security recognizes common law. Because the state, Social Security has to go by what the state determines. State does marriage and divorce. So if the state says common law applies, then common law applies, and Social Security has to abide by that. But 10 years and independently entitled divorce spouse, so many people out there are missing benefits on spouse benefits. Incredible. We just found someone a few days ago that got an extra $2,000 a month. They should have gotten it starting 2021, but they didn't know about it. And they watched our video because somebody subscribed or shared it to them or press liked, and the algorithm got it to this person, and the person said, well, that's me. Wait a second. And they called up and they got an extra $2,000 a month. So many people out there like that. So please do all that. Subscribe and all that. Anyway, so independently entitled divorce spouse benefits, you have to file for benefits on your own record. And then if your ex is eligible for benefits, not necessarily receiving benefits, but they're eligible. That means they're at least 62 years old or they're receiving disability benefits. Then you can file even if they haven't filed themselves. A lot of people miss that. You had to be married 10 years. And this is the only one where this one applies. You have to be divorced for 2 years. So the final divorce has to be 2 years. Only on independently entitled divorce spouse. Let's not mix those up. A lot of people mix that up and lose benefits. And then there's what's called the child and care benefits. If you're a spouse of someone receiving retirement benefits or disabled benefits or are deceased, you can receive child and care benefits. That means you're taking care of a child under the age of 16 or someone that became disabled before the age of 22. So that's more benefits for that person. There's work requirements, obviously, but anyway. And then there's the lump sum death benefit, which is lump sum death payment, which is the most embarrassing things at Social Security. It's $255. It's been $255 for decades and decades and decades. So if you lose someone, you can get, possibly survivor benefits, but you can also get that one-time lump sum of the $255. Yeah. Anyway, there's one that almost nobody knows about, parents benefit. So if you're dependent on a adult child, and that person passed away, parents can receive benefits off that person's record, but they have to prove, that they were dependent on that person's income. Grandparents, yes, grandparents can receive benefits for their grandkids, but they have to adopt that grandchild, or the child's parents have to be disabled or deceased. So if there's a lot of grandparents out there taking care of grandchildren, and they want to know, well, I'm receiving retirement benefits. Can my child under the age of 18 receive benefits on my record? Yes, if those qualifications are met. And then we've got obviously SNAP benefits, which is another one that is going to really be hurt going forward, is food stamps. Before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and food stamps and all the rest of it. So I answer questions about that. People have overpayments out there that they're dealing with. You can fight an overpayment if Social Security makes a mistake. If you get overpaid, whatever the case may be, again, on my website, mygovexpert.com, I've got on, you click on more, click on overpayments, and it gives you all the different ways you can, pay the whole thing off, request a lower withholding, and Doge changed all that. Then they changed it again, and then they changed it back. So Doge just didn't know what they were doing from day one. So there's that. But someone says, I heard they're broken up. Yes, they're broken up, but all the people that were in Doge have gone out to the different agencies. So there's a bunch of Doge people. The commissioner of Social Security, with the commissioner of Social Security, his part-time job is Social Security. which has never happened since 1935, that you have a commissioner of Social Security that moonlights as a Social Security commissioner. He's also the CEO of the IRS, which is a brand new made-up title. So it's crazy. Okay. So appeals, fight. That's what a lot of people miss. If you got to fight. If you're denied retirement benefits, disability benefits, SSI, Medicare, Medicaid, your Medicare Advantage plan gives you a prior authorization that you disagree with, your doctor disagree with, fight, appeal. Always, always, always. And then a lot of people are living overseas, and there's a bunch of qualifications for people living overseas. And I've got my website, and it talks about an entire section on living overseas. All right. I think I took a breath somewhere in there. So let's see. Yes, let's get into some questions here. This is the one that the Doge team has disbanded, and they say it isn't true. Any insight on this? Yes, they did officially Band-Aid as an official, unofficial, because they were never, it was never a separate agency by Congress, and a president, any president cannot set up a separate agency like that. Congress has to do that. So they were never really a separate agency, but they were because, Congress anyway. But they're no longer a separate agency, I guess, in name and paper. But all the people that were working for Doge have gone out, and including, again, the head of Social Security, and there's, a bunch of people. I think Big Balls is still at Social Security. So, yeah. With the retirement age changing, will that also change the age we can withdraw from a 401 account without penalty fees? No, Social Security, they changed the full retirement age in the early 1980s, and it's finally, the final change finally happened this year. So it was, full retirement age was 65, and then it changed it to 65 in a few months, and 65 in a few more months, and then 66 and 66 in a few months. Now it's finally happened to where it's 67 for everybody going forward if you're born in 1960 and after. So, but there's a lot of ideas out there to shore up Social Security, because everybody is going to get a cut in the future. As of right now, we've got 86 more checks. So if you're receiving a Social Security check, you're good for 86 more checks. You're going to get your current benefit amount, obviously increased for COLA and everything. But your 87th check is going to be cut by about 23%. Why? Because our politicians haven't done anything for 40 years to address the issue, other than giving us all kinds of stupid distractions about the money stolen. It was given to undocumented immigrants, and they're just distracting us. And yeah, there's a lot of people out there, not our community here, they're smarter than that. But it needs to be addressed, and it's not being addressed. There's no plan to address it, unfortunately. So we need to, reach out to your politicians. Let's see, what other kind of smash the cap? Yes, that's the number one way that a lot of people talk about smashing the cap. I am Semper Fi, Ura. I'm 61 on SSDI. Have my Medicare good to go through chapter for 2026. At what age do I move to regular Social Security? And what do I have to do? Okay, let me go, since you asked, and you're a former Marine, Ura, like your Alpha uniform there. It looks like not sure what, I can't see your whether you got an expert or the toilet bowl in terms of at the rifle range there. For some reason, I was really good at the M16. I got 8 years, the entire 8 years I was in the Marine Corps, I got expert, the highest you could possibly get every single time. Not sure how that happened, but for some reason I was good at it. So you're on SSDI. Your SSDI is going to switch to regular retirement benefits at your full retirement age, so 67 years old. And you don't have to do anything. It automatically switches over. No more work CDRs, no more medical CDRs, no more work limitations. But there's a few things you have to make sure you do. The one thing you did is reviewed your Medicare plan for 2026. You called chapter, and they checked to see if your current plan was the best. If it is, you don't have to do anything. If there's a better one, then they said, hey, here's a better one. What do you think? So you did that one. There, you're good. When you turn 62, if you're eligible for spouse benefits, check to see if you're eligible for spouse benefits. And that doesn't affect your SSDI. You get more money added on. One offsets the other. And even at 60, if you're on SSDI and you're eligible for survivor benefits at 60, which survivor benefits start at 60, unless you're disabled, then you can get benefits and SSDI. So at 62, you can get SSDI and spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. And then when you hit 65, probably right now you're getting a Medicare Advantage plan. In most states, that's all you can get under the age of 65. But once you turn 65, if you choose to get a Medicare supplement plan, again, in most states, then you can get a Medicare supplement plan without any health underwriting, without any extra costs. And then when you hit 67, then you're switched over to regular old retirement benefits. So, let's see, what else? Is it worth getting a Social Security lawyer? It really depends on what stage you're at. I always, the first couple of stages, the initial stage and the reconsideration stage, you can usually do by yourself. A lot of times lawyers, you call them up and they screen you and they see whether it's a slam dunk easy case. And if it's a slam dunk easy case and they'll make money, then they'll take you on. But the first two stages are relatively easy-ish. If you're denied the first two times and you have to go to administrative law judge, your appeal, then I'd highly recommend getting a lawyer. And then usually the best is just to find some type of local lawyer. We're trying to find a national one that might help out, but yeah, usually a local lawyer that knows the local judges and everything. So, but we've also, we've started everything on our websites. We've got two websites. We've got 24help.org, which is y'all can use for your discussions. So if you want to talk about retirement benefits, ask questions amongst the best community on social media, disability, Medicare, the Affordable Care Act, Medicaid, housing, anything like that. These are the discussion forums that you go in there and ask questions. But we've also recently set up, I've got a bunch of former Social Security employees that just recently retired, Mai Jackson and Chandra and Allison and Brandy, and you can schedule an appointment. And these are the only things that we charge for because these are one-on-one appointments. So if you need help, you've got questions about filing for retirement benefits or survivor benefits or the lump sum death benefit or disabled adult child benefits or SSI or filing for disability benefits or appealing a disability benefits or appealing an overpayment decision, you can schedule an appointment, a one-on-one appointment with any of these former Social Security experts. And again, this is the only thing we do charge for because these are one-on-one appointments. This is a brand new thing we just started and adding more there. And we charge for that. It pays for their time and it also supports all the websites. So you get help and you're able to support our website and all other free stuff, calculators and all that. So we appreciate it. She had tried to work but can't. So yeah, so if you're in disability and if you try to work, there's that trial work period. It's 9 months. You can make $1 billion a month and collect your Social Security disability benefits, SSDI. And that's how Congress set it up. They say, yeah, we wanted people to try to go back to work. So let's give them 9 months to do whatever they want. After that 9 months, if you're not able to work, then you're not able to work and no harm, no foul. But if you're able to work making $1 billion a month, then you're not going to need disability anymore. So let's see. Only about 1/3 of the people currently watching have liked the video. Let's have a post-Thanksgiving Friday thumbs up. Yes, please. Please. I took off yesterday, but I am back. Please like. It teaches these stupid algorithms. You know, we're slaves to these computer algorithms nowadays. So in order to get this information out there, that's what we have to do, unfortunately, is press like and subscribe. And yeah, so I wish it was different. I wish Social Security, Congress provided the resources to Social Security so they could provide this information and help you and pick up the phone and tell you the right information and stuff like that. But Congress doesn't want to do that. So that's why I've come out of semi-retirement and have done a couple of thousand videos about all this. So yeah, shouldn't have to do this, but I'm going to keep doing it until all my hair falls out or Social Security gets on the ball. I have a feeling I know which one's going to happen first. But anyway, after applying for divorced spouse, after being on SSI, the letter says I have until October 2026 to dispute the SSI. If not, it will drop. Does this mean they can get me for overpayment on higher amount? Okay, so when you're on SSI, supplemental security income, the welfare-based benefit, that money comes out of the general taxation. It doesn't come out of the Social Security Trust Fund. So Social Security employees, Social Security, supposed to be stewards of public money. If you're on SSI and you're eligible for any other benefits, they make you sign for those other benefits. So if you're receiving SSI and you're eligible for survivor benefits or divorce benefits or retirement benefits on your own record, as soon as you're eligible for those benefits, you're mandated to take those benefits. That's why it's saying that yeah, you're eligible for divorce spouse benefits in October 2026. You have to file. If you decide not to file, any money you receive from SSI could be an overpayment. So you have to file. You're mandated. Other people that are not receiving SSI don't. They can wait until their full retirement age and all the rest of it. So, but yeah, you have to file for benefits. If you don't, then yeah, you're going to have an overpayment issues. So just file. Oh, another Marine. I like got the dress blues on. Got a couple of ribbons on there. Got the, I can't see the medals. Navy Achievement Medal, maybe. Good conduct. Beginning benefits at 62, September 2026, will be over the earnings limit by $16,000 annually. Will continue working. Will overage be repaid to SSA by lowered benefit amount? Thanks, Devil Dog. Ura. I think, Charles, aren't you the same one that sent a video in? I think you're the Gunny Charles. Let's see here.
Hey, Dr. Ed. Gunny West here.
Oh, different guy.
McDonald, Tennessee.
Same question.
I'm considering applying for Social Security benefits September of 2026. I'm familiar with my earning limits, and I know that I will exceed the earning limits and continue to do so if I remain healthy until full retirement age. I know they recoup the overpayment of benefits by 2-to-1 ratio, $2 to 1. Will I continue to, if I apply for benefits in September, will I continue to receive monthly benefits at a lowered rate, or do they stop the benefits for a matter of months each year until the overage is recouped? I'm just wondering because I would like to go ahead and draw, and whatever they allow me to take monthly, invest it into my current company's 401k. Thanks very much. Semper Fi.
Okay. All right. So those two questions kind of dovetailed in there. So I'll throw those together. All right. So what are we looking at here? A few things. So we're looking at the AET, MET, and the ARF and early and all that kind of good stuff. So, okay. Number one thing, the monthly earnings test. So the first time you start your Social Security benefits, when you start your Social Security retirement benefits or spouse benefits, it's not the annual. So in this year of 2025, it's $23,400. So, but Social Security doesn't care how much you make this year before you start your Social Security benefits. So Marines, we always exaggerate for effect, as we call it. Let's say you're going to start your benefits in November this month, and you made $1 billion a month for the first 10 months, January through October. That's definitely way over the $23,400, right? So you're like, wow, I made $1 billion. I definitely over the $23,400, so I can't start my benefits this year. Wrong. The first time you start those benefits, you're at the monthly earnings limit. And that is, for this year, it's $1,950. 2026, it's $2,040. So Social Security, when you go into Social Security, let's say November, and say, hey, I want to start my benefits in November. And they say, how much did you make this year? $1 billion. And they're like, wow, are you hiring? And then they say, okay, we don't care about that. How much are you going to make this month in November, December? oh, I'm gonna be under $1,950 for November, December. They said, okay, all right, we're gonna start your benefits November, December. How much are you gonna make next year? Oh, next year, yeah, I stopped that $1 billion, income. Next year, I'm gonna be under the annual earnings limit, the $24,480. So they said, okay, cool, your check will just keep on coming. But if you say, okay, I want to start my benefits in January and I'm going to make $10,000 over the limit, and I'm going to work every month over the monthly. So I'm going to make $10,000 over. So I'm going to make $34,480, $10,000 over. So they're going to hold back $1 for every $2 you go over. $1 for every $2 is $5,000, right? So they're going to hold back $5,000 worth of benefits. So if your monthly benefit amount, they're not going to give you a partial. They're going to hold back suspend the entire month. So if you're $5,000 over and your monthly benefit amount is $2,000, they will hold back January, February, and March. People are saying, Ed, that's $6,000. That's correct. They cannot pay a partial month. So they're going to hold back $6,000 of benefits, 3 checks, January, February, March, and then you're going to get your April check in May. It always comes a month late. And that's when you get your first check. So they will withhold the entire month until you get the $1 for every $2 you go over. Once you hit your full retirement age, the year you hit your full retirement age, it's different actually. That year, the year you reach your full retirement age, the limit is $65,160 for 2026. That's before you hit your full retirement age. The month you hit your full retirement age, they can go back making $1 billion a month again. So, and then where's this ARF thing come up with? What is ARF? That is the adjusted reduction factor. So let's say you start your benefits 30 months early. So your benefits are reduced by 30 months because you started 30 months early. But after 10 months, you go back to work making way over and you suspend your benefits. So you don't get 20 checks. So you got 10 checks and then you didn't get the other 20 checks because your benefits were suspended. Once you hit your full retirement age and you restart your benefits, they're not going to give you the 30-month reduction. They're about to write a check and they say, okay, you started 30 months early, so we're going to cut you a check for 30 months reduction. I guess, oh, wait. You only took 10 months. You were suspended for the other 20. So we'll recalculate and we're going to we're going to reduce your benefits by 10 months. And then they write the check and your benefits are only suspended for 10 months. Not suspended, you're reduced, 10-month reduction. And that's called the adjusted reduction factor. And that's 100% automatic. The computer does that automatically. So hopefully that answers your question. I was wondering if I can do a payback for my on SSI. Payback. Do you have an overpayment? Yeah, if you have an overpayment, they're going to require that overpayment. For SSI, it's usually about 10% of your SSI amount. But remember, you can always fight it. If you disagree with the amount of the overpayment, or you're not able to pay 10% or 50% or whatever the case may be, you have the ability to request an appeal. It's either an SSA 561 or an SSA 632. I know it's a lot of information, but you go onto my website, mygovexpert.com. That's how we kind of have it broken down, is mygovexpert.com. Our one website has all of the details about retirement, disability, survivor benefits, Medicare, all the rest of it. So like on the enrollment periods I was just talking about, the initial enrollment period, the general enrollment period, all the rest of it has it all there. For retirement benefits, it has it all, Medicare and retirement, working and benefits, the application process, when to start and all that. So, but then our other website is, so this mygovexpert.com provides all the information. The other website is y'all helping each other. So if you're having a question about Social Security disability and you're worried about a CDR coming up, you can join the CDR discussion group. If you got questions about working and disability, you can join the disability and working discussion group. And that is all 100% free. Thanks to people talking to experts and calling chapter and all our other. So we appreciate it. They're notifying you about this so you don't get an overpayment. If you have another source, spousal benefits, then you have to take that first. Yes. So Penelope, I think, was a retired Social Security employee, and she always gives out great information. So Chapter helped me with supplement, but not with Plan D. How do I get help? Yeah, if they help you with a supplement, they're supposed to help you with the Plan D as well. So when you get a Medicare supplement, a Medigap, same thing, Plan G, N, F, or whatever the case may be, then you have to sign up for a Part D. Probably, well, this year is crazy. Under normal, previously, they were supposed to help you with the Part D, but now it's probably because you know the names of these companies. There's one big one out there, and the other ones are following suit, that they're not letting agents and brokers or whoever, Medicare insurance people, help you with a Part D. They're telling people to call companies directly and negotiate it. So yeah, for the Part D prescription drug plan, it's crazy. Chapter also does some political work. They go out there and try to stop, bad agents. And so CMS changes the policy so people can't call you and harass you. They haven't succeeded on that one, but the CEO of Chapter goes up to Congress every now and then and testifies and tries to get stuff. And I think they're working on that one too. But the Medicare insurance companies are having a hard time with Part D, and they're making everybody pay for it. So yeah, it's unfortunate. So probably the best way is to go to Medicare.gov, but those are basically the two options right now. It's unsatisfactory, unsat, as we used to say in the Marine Corps. You can either call up individual companies and ask them about, whatever the plans, or you can go to Medicare.gov and review your plans there. But be careful. I think this is probably allegedly one of the tricks that they're doing is that if you have a Medicare supplement plan, a Medigap, Plan N or G or F, you're paying a monthly premium. So you didn't get a Medicare Advantage plan. You got a Medigap, a Medicare supplement plan, and you're paying a monthly premium. Insurance companies make more money when you sign up for a Medicare Advantage plan. It's crazy. Zero premium, but they make more money because they get paid $1,000 or so more from the government when you sign up for a Medicare Advantage plan. So they make more money when you have Medicare Advantage plan. So if you have a Medicare supplement plan, and you also have a Part D, which you should have, a prescription drug plan, the prescription drug plan company, those companies also have Medicare Advantage plans. And they want to switch you to a Medicare Advantage plan because it's good for them. They make more money. You have your nickel and dimes, and you have prior authorizations and limited networks and all the rest of it, but it's good for the insurance companies. So they want to switch you to a Medicare Advantage plan. So if you have a Part D plan and you want to switch it and you call some company and they're say, oh, we've got a better idea for you. We've got this plan. You're paying $150 a month for your Plan G. We've got a plan that's zero premium, and we'll give you dental and vision and, free ice cream and unicorns, and it's so awesome. Why don't you sign up for this? And then one day you wake up and you realize you just signed up for Medicare Advantage plan, and you've got the prior authorizations. They second guess your doctors, and they deny this and they deny that. So be careful. Someone calls you like that and says, yeah, you got but we just came out with this new thing in your area. We've got this free gym membership and this free this and this free that, and it's awesome. And why don't you change it? And yeah, be very, very careful. Be very, very careful. If there are a lot of people there are some people that, have a Medicare supplement plan, particularly those with Plan F, that their prices are going up and they just can't afford it anymore. And then they switch to Medicare Advantage. But, that's your personal decision. If you do it, if you make any of these changes knowing full well what you're getting into and your options and you're educated about it, then it's your decision, period, end of story. But we just want to make sure, you're not tricked into anything. Can you not file for widows when spouse dies, even if you have SSI? I've been going through BS, not going how I was told, and I'm not understanding how they have figured my spousal. Can you not file for you? No, when you're on SSI, you have to file. If you're eligible for any other benefits, it's kind of like if you're on, any type of welfare program, Medicaid, food stamps, SSI, whatever the case may be, and then your uncle passes away and leaves you $1 million. And you're like, oh yeah, no, I'm just going to leave that in this. I'm not going to access it. And I'm just going to continue to receive my welfare-based benefits, SSI, Medicaid, or SNAP, or something like that. It says, well, do you have $1 million? Yeah, but I don't want to access it. I want to just go ahead and keep getting, no. So it's kind of the same type of idea. So let's see here. 30 minutes of repeat info. Could alternate days, 1 day all questions, 1 day info to want to teach, or shorten teaching to 15 minutes must be a better way. Medicare school whips through questions and out. Yeah, they just deal with Medicare and yeah. 30 minutes of repeat info. Could you alternate 1 day questions? I did that where it's just, I've done videos where it's just questions and nobody joins. It's all, you need a topic of the day. I've tried it. Yeah. And they do a topic of the day too. And I wish they would not give out Social Security information because they just don't know. Yeah, I wish everybody out there in social media, if you personally didn't take hundreds of thousands of retirement claims, survivor benefits, disability benefits, worked in the agency for decades, then I don't think people should out there be given, sometimes I reach out to these channels and I tell them, you just gave out wrong information. Sometimes they take it down, sometimes they don't. And people, so. I gave the Riot Act to an online ad to support Medicare disadvantage at Congress. I admonished them to stop calling it Plan C, as there's no such thing. Yeah, it's technically is Plan C, but yeah, you and I are both on the same page. We don't like being called Plan C because it sounds like it's, I mean, a lot of people love it. There's a lot of people that love their Medicare Advantage plan. They're doing it right. They're fighting when they need to fight. They're being treated well right now. But over 50% get a Medicare Advantage plan. If your budget just doesn't allow you to get a Medicare supplement plan because you're going to have to pay you're paying Part B, the $185. You are having to pay the Medicare supplement premium. You're paying a Part D. There is no dental, vision, or hearing in there. And if you've got the budget to do all that, then more power to you. No prior authorization, no doctors. I did a video a few days ago on that's Medicare for all. The people that have Medicare supplement plans, Plan F, G, N, you have Medicare for all. So everybody wants that without the monthly premium and stuff. And so it's actually cheaper for what we're paying now. So those people that have Medicare supplement plan, people always say, well, when we have universal health care, it's going to be like Canada and we're going to have all these long waits and stuff like that. For those people that have Medicare supplement plans, do you have long waits? Versus Medicare Advantage plans who, or people that don't have health insurance at all because they can't afford it. The 20 million Americans that are not going to get health insurance because premiums are too high in the ACA. Anyway, they need to smash the cap. Everyone needs their Social Security. 23% less is not okay. That is a fact. So definitely reach out. Asking for a 62-year-old neighbor. There we go. Our superhero of the day. On SSDI, me, then 10 years, who wants to go on SSI retirement. Will her payments increase? No. When your benefits are switched from Social Security disability benefits to regular retirement benefits when she hits her full retirement age, it stays the same. That's why a lot of people, they come into our live Q&A and they're say, I'm 85 years old and I'm on Social Security disability. We're like, no, you're not. Your disability benefits stopped 20 years ago. You're on regular retirement benefits. And the importance of that is they think they're on disability and they're still worrying about getting a CDR. And they're stressing about that. They're never going to get a CDR again because they're not on disability benefits. They might be disabled, but they're not on disability benefits from Social Security. And they're allowed to work. There's no more work limitations. So remember, on your neighbor, so She was eligible here. He or she is eligible for benefit. She check to see if she was married to anybody for 10-year divorce, 10 years or longer. If she was married to anybody when that person passed away, she might be eligible for survivor benefits. At 62, eligible for spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. Check that out. And hopefully you can find some money for her and you will be the neighborhood hero. So that's what we're looking for. And let us know how it goes. And if she's having a hard time paying for, because she's on Medicare, she's been receiving SSDI for 2 years, she's on Medicare. She's having a hard time paying for that. Make sure she reaches out to Medicaid and files for that. So, all right, let's see here. Get some other. My husband wants to retire at 62. He's 60 now. I'm on SSDI. Does he have any recourse to be able to get affordable health insurance before he is 65 and qualify for Medicare benefits? Yeah, unfortunately, no. You're on SSDI, so you got Medicare after 24 months. But if he is not on SSDI, then he has to wait till 65. And unfortunately, the Affordable Care Act, they hamstrung it. They pretty much destroyed it. I think I made a graphic of the Affordable Care Act. So the original, what they call Obamacare, which, it was the Affordable Care Act, marketplace insurance. But anyway, so that's the original. And then now the Affordable Care Act is with a little Lego engine in it. And what's the difference is the mandates. All insurance works the same. It's a pooled risk. The more people you have in the pool, the cheaper it is for everybody else. Pooled risk. That's how insurance been like that for hundreds of years. When under the last Trump administration, they got rid of the mandate, essentially. They didn't get rid of it. They just made it zero, which is basically the same thing as getting rid of it. So a lot of healthy people dropped out of the pool. And that's why prices have been skyrocketing ever since, is because only sick people are staying in there that have to stay in there. And then the government came up with subsidies to try to help people, but now it's going to get even worse. It's going to get even worse. And so the same people that essentially hamstrung it are made it so expensive are now saying that it's what we have today is not the original Affordable Care Act. It is, the one on the right. I was trying to figure out a way to kind of explain that, and I'm a car guy, so it always came up to being a car. So anyway, let's see here. Married for 24 years. Husband passed in July this year. I am on disability at 59. Called Social Security, was told I will get survivor benefits. I have not received it yet. What do I do? I am on disability. Okay, yeah, you have to wait till you're 60. Okay, so your husband passed. You're on disability. So are you talking about, because you're right on the borderline. You could get disabled widow's benefits on his record, which is 71.5% of his benefit amount, or you can get the survivor at 60, which is basically the same amount. So not sure whether they're doing the disabled widow's benefits or doing regular surviving spouse benefits. It really depends on that benefit amount and your benefit amount. But did you actually file a claim, or did you call up and schedule an appointment and give them some information and you thought that happens all the time? You call the 800 number of the local office and they ask you some questions. You set up an appointment, or they're setting up an appointment. They don't tell you they're setting up an appointment or developing a lead, protective filing. So I would call them up again, and your 800 number should be able to see what's going on in there, or your local office, and say, hey, what's going on? Am I getting DWIB, or am I getting surviving spouse? Disabled widow's benefits, or am I getting survivor spouse benefits? What's going on? When my benefit will start and when will it increase? Because if they actually took a claim and pushed the button, within 7 to 10 days, you would have received a letter in the mail or in your My Social Security account that says, hey, we've got here's the deal. We've taken your application, we're in the process, or we adjudicated it, and here's how much your benefits are going to increase this month, and how much they're going to increase by. So if you didn't get that, if you're not sure what's going on with it, definitely reach out to them and find out what's going on. yeah, just make sure it doesn't fall through the cracks there, because Social Security just doesn't have the staff to do the right thing on time, unfortunately. All right, let's get another video question.
Hello. Yeah, I typed you a letter about this Advantage PPO plan being canceled in Northern California. It's the Anthem Advantage, and I called Justin Davis at Chapter, and he got me a plan together for Imperial. And anyway, I waited for 10 days and no plan came. So I got back on the horn and talked to Anthem and got to the people on top. And my plan, my Anthem dual eligibility PPO, is still in place. It's still good. It's the best plan out there. And I don't know where the mix-up was, but it was major here in Northern California. But the Advantage, Anthem Advantage PPO 2 plan is good, and it's rolling. That's all I can say. I hope everybody gets this message that's trying to get into that plan, because it's the best thing out there.
Okay, bunch of red flags there. All right, when you change your plan, you call Chapter. It doesn't matter who you call, someone you know and trust. You call them up right now with the annual enrollment period. You change your plan. Your new plan doesn't start till January 1st. Whatever you change your plan to, it doesn't start till January 1st. And if you just don't do anything, your current plan expires December 31st, and then it rolls over January 1st. And sometimes under the hood type stuff changes, and that's why you need to review your plan. But he changed his plan. He was expecting his new plan to start and get the new letter for the new plan and stuff like that. Yeah, it doesn't happen during the annual enrollment period, because it has to go through Medicare, and then Medicare sends checks, and they basically cancel out your previous plan December 31st, and your new plan starts January 1st. So yeah, don't expect something almost immediately like that. And then he called the same company, and guess what? They said, "Oh yeah, our plan is the best." So. Which is a dual advantage plan. So that means he has Medicare and Medicaid. But it sounds like Chapter already checked and said this other one is best for your particular situation. And anybody that tells you this is the best plan out there, yeah, for them in that particular area, because they have their doctors and they have Medicaid, he has Medicaid, and he has these prescriptions, and yeah, maybe that plan is the best for him, but it's not the best for the neighbor that has different doctors, different prescriptions, different needs. So nobody can tell you. Always do it based on your particular situation. So yeah, that's red flags all over the place. Because you called the same company and they said, yes, your current company is rolling, it's all good. Yes, the current company you have is still in effect until December 31st. So you said, yeah, it's still good, it's still rolling, it's still the best. The best this year, because this is the one you signed up for, and it's going to be, I guess, the best until December 31st. And then, not so much, January 1st, when your new plan. So I'm thinking what they did is they switched you back to the plan you had before, and that plan, which is the best right now, just might not be the best starting January 1st. And so, yeah, and companies, they'll do that. Oh yeah, no, your plan is still in effect, and so it's still the best right now, and so we'll just go ahead and move you back to that one. But they didn't tell you that, well, starting next year, there's other plans, and we're not going to tell you about that might be better. So it's crazy out there. It's crazy out there. All right, we have another question here, video question.
My name is Brunelle. I'm from Mississippi. I am receiving Social Security disability. I'm divorced from my husband of 19 years. He's since remarried. I have not. Can I receive Social Security income from him? He was born in 1955. Thank you for your answer.
All right, thank you for your question. Okay, so he is still out there alive and kicking. So the calculations are your benefit amount has to be less than half of his. So you're receiving benefits on your own record. You're at least 62 years old. and your benefits amount have to be less than half of his. So, and then you'll get the difference up to 50%. So I would call up, the best way to do it, because you don't there's a difference between the PIA and the MBA. The PIA is the primary insurance amount. That's the benefit you would get at your full retirement age. Anybody gets a full retirement age is called the PIA. That's the number Social Security goes by when they're looking at whether you get 50% or 100% or 75% or whatever the case may be. That's the number they look at. But what we see a lot of people, they look at the MBA, which is the monthly benefit amount. They're sitting there in the living room watching TV, and they say, "Hey, Ed said I can get benefits off this other person, off your record. You got a husband and wife sitting there watching. Ed says I can get benefit if my benefit amount is less than half a year's. How much is your check? Oh, my check is this. How much is your check? Oh, well, it's not less than." Don't go by that number. Don't go by that number, because one of you might take benefits early or delayed or getting Medicare taken out or an overpayment taken. Don't go by the monthly benefit amount, your check amount. You have to go by the PIA, the primary insurance amount. And how do you do that? This young lady, you should call Social Security, call the local office, call 800 and say, "Here's my ex's Social Security number," if you know it. If you don't know it, no problem. Just tell them the person's name, the date of birth as well as you know it, where they were born, city and state, and they will be able to find that person's Social Security number. And if they'll look at that person's PIA and your PIA, and if your benefit amount is less than half, they will schedule an appointment and you'll get their money. And what a lot of people miss is if she called, so please share, subscribe, reach out to your people that you in your network. Let's say she calls right now today and they say, "Oh, no, you're not eligible for benefits on his record because," and they don't tell you the reason. You're not eligible. You're married 10 years. You're receiving benefits, yada, yada, yada. But they say you're not eligible for benefits on that person's record right now, or they don't tell you the full story. And possibly the reason you're not eligible for benefits on that person's record is your benefit amount is not less than half of his or hers. And then there's thousands, tens of thousands, hundreds of thousands of people out there that heard that and think they're never eligible for benefits. And they're struggling. So let's go out there and help them. Says, "Hey, weren't you married to someone before? Yeah. Or did you ever check to see if you're eligible for benefits on that person's record? Yeah, but I wasn't, and so I just forgot about it." Well, okay. Has the situation changed? Has that person continued to work and their PIA has increased? Then you're eligible for benefits. Has that person passed away? Then it goes from 50% to 100%. Says, "Oh yeah, I didn't think about that." That's kind of a situation we had a little while ago. Eligible for benefits, but not at that particular time. Situation changes later and they're eligible for benefits. So too many people out there not getting the benefits and they're struggling. So let's go out there and help them. All right, we're way over an hour. Since I wasn't here yesterday, I'm going a little bit over answering some questions, but let's get a few more here. I'm 67 and I begin collecting Social Security, but continue working full time to 70 years. Will my benefits be adjusted annually to accommodate the additional benefit? Yes. If your employment is one of your high earnings, and let me pull up my little graph there that shows. So how they calculate your Social Security benefits is based on, they look at your high 35 years of earnings, and then they do this AMI, average index monthly earnings, and calculate it by this bin point formula here. And anyway, that's how the sausage is made. If you continue to work, so let's say 2025, you make, one of your high earnings, years of earnings. Once you file your taxes or your employer notifies Social Security how much you made and everything like that, then Social Security will look at that and they will say, "Hey, this is one of the president's high 35 years of earnings." So they will kick out the low one, stick in the new one, and recalculate your benefits. And that's 100% automatic. Sometimes it takes time. We had some people last month that just got it. They came in here and says, "I just got another, $47 or $147 on my check. Where'd that come from?" It's like, "Well, did you work last year?" "Yeah, I worked last year." Okay. Was it one of your high 35 years of earnings? Yeah. Then that's it right there, because they pay you. That person got, like, let's say an extra $10 a month going forward, but they also got $100 lump sum check, because Social Security goes all the way back until January and gives you that money back all the way to January. So, Connie, a $10 donation to support the cause. We appreciate it, and we've got a bunch of new subscribers and people that donated. You guys are awesome. I appreciate it. And we're going to be updating the websites for 2026 and all that. So we appreciate all y'all's help. All y'all help. What are the effects of continuing to full-time when collecting Social Security at Social Security? Yeah, so basically what I just said, and that continues forever. If you're 65 and continue working and collecting, and you're collecting benefits, then your benefits will increase if that's one of your high 35 years. So your work will always increase if it's one of the high 35, whether you're 65, 75, 85, 95, or 100. Remember, so that's why it's important that you check your earnings record. And remember, this part right here, your earnings, your high 35 years of earnings, this little key, right? Earnings are adjusted for wage growth, indexed. So people say, hey, I made $80,000 this year. And that's definitely one of my high years, because one of the low ones was when I made $20,000 scooping ice cream when I was in high school. No, that $20,000 when you're in high school in 1980, 82 or whatever, that's more than the $80,000 you make this year, because they index it for wage and growth. So it's probably like that $20,000 you made back then in the 70s, early 80s or something. It's probably worth $100,000 today, because again, they wage index it. So it's kind of, adjusted for inflation, actually wage index. So don't discount those early years. Say, well, it's missing that 20, my work record is missing that $20,000 I made back then. Yeah, it's no big deal. It's only $20,000. No, that's, might be over $80,000, $100,000 now. So, all right. All right. I think that is it. Oh, let's do this last one here. I think, new person and became a member. You were too awesome. Appreciate it. I was just approved for disability after hiring a lawyer. After you receive a letter, you're just hanging on a hook, not knowing what to do. I burnt through my 401 trying to stay afloat on my own. Yeah, it's going to get a lot worse. For initial claim, it takes 6 to 9 months if you're lucky to get a decision. If you're really, really super, super disabled, there are a bunch of compassionate allowances, and there's all kinds of different things. I've had cases where I've taken a disability case in the morning and it was approved the same day. Those are usually terrible, terrible cases, unfortunately. The disabilities, that is. But yeah, 6 to 9 months if you're lucky. And then you file a reconsideration, the second level appeal, 6 to 9 months. If you file an appeal, the ALJ, that takes another year or so at least. So it's going to get worse. And because politicians are refusing to provide resources to help you get your benefits. You paid, Leah, you paid, that's benefit you paid. When you paid your FICA taxes, your Social Security taxes, all those decades, you paid that to where when you needed your retirement at 62 or 67, you would get that money and you would get help to make sure you get the right check at the right time. But politicians are refusing to provide that. And now you're filed for disability, same type of situation. Politicians have failed, and it's even worse now. And this is not, I'm not only talking about the current administration. This has gone on. This is the staffing at Social Security. The gray bars there, those are the baby boomers, the number of beneficiaries receiving benefits. It's about 71 million people right now. And Social Security staff has gone down. It's even before Doge and Elon Musk, it was at the lowest level in 50 years. And these are people that are there, supposed to be there answering the phones and answering your questions. And they're adjudicating your claims and making sure you get the right check at the right amount. at the right time, and they are there to review fraud cases and all the rest of it, but there's nobody there. Yeah, it's unfortunate, but this is what our politicians, they want to cut the system from the inside. So in 87 more checks, once we get down, this is how the Affordable Care Act is working. They had no plan, repeal and replace for over 10 years. They never had a plan. And at the last minute, yeah, it's some BS plan that they don't even know what they're doing. And everything gets cut. So they're going to do the same thing with Social Security. They're going to wait till the last minute and say, we tried nothing and we're all of ideas. So let's just go ahead and give it over to Wall Street so we can get our commissions and our cuts and our back end. Yeah. So anyway, but we're smarter than them. We just have to take action. So, all right. Way over time. I'll be back again tomorrow. Come up with another topic. And all those people that, if you've got questions, which I'm sure you do, on any of those and more, make sure you join me on a future broadcast and type your question in there. Or better yet, make a video. How do you make a video? You go into mygovexpert.com there. And let me pull it up there. Yep. And on the bottom left of each page, you see the little question or comment. You click on that and you can record a 2-minute video and you can ask me a question. Some other young lady sent me a video today, but it didn't have any audio. So if you recorded your video within the last 24 hours, you know who I'm talking about, young lady. I didn't answer your question today because I saw your beautiful face, but I didn't hear your voice. So record it again. And yeah, I'll be sure to answer it tomorrow. All right, y'all take care. Have a beautiful night. And please, 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 please take care of each other. Bye-bye.